Hello everyone. So from today onwards we are going to start the pharmacology. So today we are going to start about the general pharmacology. As we know, there are the two terms in the pharmacology which are like very important as the basics of the pharmacology, the general pharmacology. The first is pharmacokinetics. Okay, as the name suggests, pharma means drug and kinetics means movement. As the name suggests, pharmacokinetics is the movement of the drug inside the body. Okay, like what will happen in the pharmacokinetics, how the drug will move in the body, like it will get absorbed, then it will circulate, and then it will excreted. Okay, and another term, very important term is, and another very important term is pharmacodynamics. Okay, the pharmacodynamics deal with the effect which is produced by the drug. In short, we can say that pharmacokinetics is what the body does to the drug, and dynamic means what a drug does to the body. Okay, my dear friends. So now we will see the first part of the pharmacokinetics. Okay, there are four processes in the pharmacokinetics mainly. We call it as ADME. We said ADME study. What is ADME study? Like A for absorption, D for distribution, M for metabolism, and E for excretion. Okay, so these four things we study in pharmacokinetics. So what we see in absorption, first we will take an overview of the things. In absorption, what happens mainly when we take drug orally? Okay, after it goes into the our gastrointestinal tract, like stomach, intestine. Yes, after that it crosses the cells, like the cell membrane, and after that it reaches to the bloodstream. Right, now what happens in the distribution? During the distribution process, like as we seen in the absorption, the drug has reached to the blood. Now from the blood it will reach to the organs. Okay, now the metabolism is there. Next process, as we have seen, the drug is reached to the organs. So the drug, it will go to the liver and it will become water soluble. The main purpose of the metabolism process is to make a lipid soluble drug in the form of water soluble, so that it can be excreted. Like in more detail I will explain you about it further. Okay, So first we will see about the absorption in detail. Okay, the absorption. So what happens in the absorption? Absorption is a cellular barrier like which a drug needs to cross to reach to the circulation, systemic circulation. Okay, so some are the principles of the absorption. Okay, we will see that. The one is how does a drug cross the cellular barrier, then the route of administration, and then the bioavailability of the drug. We will see them one by one. So first we will see the ways by which drug can cross membrane. Okay, suppose this is stomach. The medicine we have taken, it came here. Now it needs to cross this membrane, right? This membrane. So by by which ways it can cross the membrane, we will see that. Okay, the first one is simple or by passive diffusion. Okay, as we know, the cell membrane is made up of phospholipids, right? So they are lipophilic. What it means, like the lipid soluble drug will cross easily. Okay, so and here no ATP or energy is required. Yes, and here we can say no ATP required, right? And it will go along the concentration gradient, like from high concentration to it will move low concentration. Okay, and mostly the drug, like most of the drug, cross by simple or passive diffusion. Okay, and only lipid soluble drug will be crossed from this method. Okay, the another way is aqueous diffusion. So in aqueous diffusion, like the hydrophilic, like the water soluble drug crosses the membrane. Okay, by this method water soluble drugs cross membrane. Okay, so like how it will cross the membrane, like water soluble drugs are not lipid soluble obviously, so it can't be cross the phospholipid bilayer. So how it will enter into the body, how it will get absorbed? So in the cell membrane, aquaporins are present. These are the small pores which is present in the membrane, through which the water soluble drug can pass the membrane. Okay, here also no ATP required. Okay, and it is mainly like commonly seen in kidney and nephron. Okay, like mainly the aquaporins and this kind of diffusion is seen in kidney and nephron. And one more thing about it, the ADH, which is antidiuretic hormone, it increases the synthesis of aquaporin. It increases synthesis of aquaporin. Okay, the another method which we have is filtration. So the drug crosses the space between two cells known as paracellular spaces. Okay, when there is a space between the two cells and the drug crosses by it, so that space is known as paracellular spaces. Okay, like this is a cell, this is one more cell, and drug is crossing by here. This space is known as paracellular space. So if the drug is crossing from the paracellular space, this process is known as filtration. Okay, crossing by paracellular space. Okay, here also no ATP is required. And in the kidney, we can see from glomerular capillaries, blood gets filtered into the nephron. Okay, so that is filtration process. An injection of insulin is given into the subcutaneous fat, and between subcutaneous fat, endothelial cells of capillary are present, through which insulin get absorbed into the blood by filtration process. Okay, so we have two examples of filtration here. The one is from glomerular capillaries, blood get filtered into the nephrons. Okay, another example is when we give injection insulin into the subcutaneous fat, so there it will like there are endothelial cells of capillaries are present. So okay, so by the endothelial cells, okay, they will go into the blood by filtration. Okay, then we have endocytosis. So what is endocytosis? It is also known as pinocytosis. Also known as pinocytosis. Okay, what happens in this? The cell changes its cell membrane through a specific receptor, and the drug enter the cell membrane. Okay, we can take an example like endocytosis. This is the cell, the drug come up here. Okay, after that the cell become like this. Okay, after some time the cell become like this. Like in this, the cell is taking up drug inside it, endocytosis. Okay, so this is the process of endocytosis, and by this process the large protein can be absorbed. For an example, vitamin B12, vitamin B12. Another example, botulinum toxin. This is a toxin produced by bacteria and it is seen in food poisoning. It is also like endocytosis. Okay. Now we have carrier mediated absorption. These all are like in all of this we have seen like directly the drug was crossing the membrane without help of anything, but now we have transport or carrier mediated absorption. In this, like someone will be there to help the drug to go inside. First is facilitated diffusion. Okay. There in this pump will be present. Okay, and the drug enters the cell with the help of pump, right? Here no work of ATPase enzyme will be seen. No work will be there. Okay, it also does not require no requirement of ATP. Okay, here the drug will move along the concentration gradient, like from the high concentration to low concentration. Example we can see here. Glut transporter. Okay. Also we have example of 5-fluorouracil. Okay, the 5-fluorouracil get absorbed through GIT by this method. Another method we have active transport. By the name we can see it is active transport, so ATP requirement will be there. Here also pump will be present. Okay, the drug will enter the cell by this pump only, but here ATPase will be present. Okay, then requirement of ATP will be there. Okay, that means this transport require the energy. Here the drug will move against the concentration gradient. Okay, against concentration gradient. That means the drug will move from low concentration to high concentration. Okay, like for an example we can take, we have sodium potassium ATPase transporter. Okay, and levodopa and methyl dopa also get absorbed from the GIT by dopamine transporter. This drug you will see in Parkinsonism in CNS chapter. So now we will see the routes of drug administration by which the drug can go into the body and get absorbed. Okay, so routes of drug administration. Okay, so first will be local, like how we can give the drug locally. Okay, so in local, what we will do, we will apply directly at the site. In this, you can see the two kind of ways. First is topical, right? Another is intraocular. Okay, so what in topical we can see, you have seen some gel or tubes to apply when you have a sprain, when you have a fungal infection on the skin. You apply topical, miconazole like creams, ketoconazole cream. When you have a pain or sprain in the leg, you apply diclofenac gel. So that is topical way of applying the medicine. Then we have the systemic way, by which the drug will enter in our body. Okay, so systemic way. Okay, in this also there are two ways. First is enteral. Okay, another one is parenteral. What is the difference between these two of the drug? Okay, so enteral means that will go and reach to your intestine or your GI tract. Okay, so that is called enteral. In this, you have in enteral you will go, like this drug will go in your GI tract, and we have parenteral. The drug will not go into your GIT, it will be in the injectable form. Okay, so in enteral we have two routes. First is oral, another one is rectal, and this both will go by first pass metabolism. I will explain further like what is first pass metabolism, what is bioavailability after this topic. Okay, and in parenteral we have intravenous injection, intramuscular, subcutaneous. Okay, like that, the route by which we are skipping the GI tract, that is parenteral. Okay, after that, non-injectable parenteral routes. Okay, we have seen this injectable, right? This all were injectable. Now in parenteral we have some other routes which are non-injectable. We will see that. First is sublingual, that is below your tongue. Okay, so what is the benefit of it? Like if you give a drug sublingual, it will act very fast. Okay, it will skip the first pass metabolism. Okay, and one more thing, self administration of drug is possible, no doctor is needed for that. Okay, another is intranasal. Okay, in intranasal, the patient will take the drug by nose. Okay, some example we can see here. Desmopressin, calcitonin, and also we have esketamine. Okay, another method which we can see is transdermal. Okay, means across the screens, across the skin. Some transdermal patches are seen nowadays, which you can apply on your skin. Transdermal route. In transdermal, it is across the skin. Okay. So what is the advantage of this? Like sudden peaks are avoided. Like if we will directly inject the drug into the body, like in the bloodstream, so like suddenly the concentration of drug will increase into the body. But what is the benefit of this transdermal patch? The drug will slowly absorbed, so the sudden peaks are avoided. Okay, and the last another route is inhalation. Okay, when you inhale, by inhalation you take any of the drugs, so that is inhalation. And the inhalation is not only by nose. Inhalation is the route. The aim of this inhalation route is that the drug should directly reach your lungs, into your lungs. So it can be go through your mouth or by nose. Okay. Example, like first we'll write it will directly goes to your lungs. Okay, so example we can see salbutamol. What is this drug? This is the drug given in asthma. You have seen the patient taking the asthmatic pump by their mouth, so that is the way of inhalation of the route.